Well, the country has moved to level 2 of the lockdown, and that means larger gatherings so political parties can campaign ahead of the local government elections. There are concerns that this may end up being super spreader events. At the same time, government is working on introducing a vaccine passport, but there are questions about whether this would lead to discrimination against those who don't want the vaccine or those who can't access it. Let's discuss this further with Professor Mosa Moshabela, Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal. Prof, thanks for your time again. Always a pleasure speaking to you. So let's start with this new rule of 500 people gathering outside, 250 people inside. And of course, this is where political parties will now be able to campaign and enjoy this latest regulation. Is it the right move or not?
Yeah, I think that from a public health perspective, Shahan, it is concerning, especially the indoor shift of change of 50 to 250 in the context of a variant, Delta variant that is highly transmissible and can be transmitted in an airborne fashion when it's indoor with poor ventilation. So that is concerning for me. But I think that, right now we also have a problem that people are not really adhering to the prevention measures. 70% in South Africa say that they will adhere to masks when they go to the public. People who are vaccinated, only 15% understand that it's important and agree that it's important to wear a mask after vaccination. So we have a bit of a problem that the public is not really ready for the measures that have been introduced in terms of adhering to the prevention measures, as well as ensuring that we're getting vaccinated. We only have 18% of South Africans that are fully vaccinated, even though about 62 to 72% are willing to take the vaccine.
Crazy, isn't it? We'll talk about that a little later, but let's focus on this campaigning issue because, of course, the election is happening on the 1st of November, but the campaigning will happen over the next couple of weeks. Could that lead to higher infections and bringing the fourth wave earlier than expected?
I think listening to what the president announced and what the Minister of Health has been saying prior to that, the position of government has been more around concern in terms of the actual voting, the day that people have to go out to vote. But as you correctly say, we need to actually worry more about the days leading up to the vote. And this is really the risk that, the crowds that would be gathered, not only in terms of political campaigns, but also religious gatherings as well. So there's a risk here that we may end up having to create conditions for Delta to spread again. And I should say that we've seen in Northern Cape and in the Free State that Delta variant can lead to resurgence. When you think that it's going down, it can go back up, which is also why we ended up with this long tail of the third wave that, seemed to be resistant to decline, straightforward decline. So I would say that we are getting into a very precarious position that we are in. We're finding ourselves in. It's understandable. There are trade-offs, but these trade-offs should not necessarily come at the risk of the South African population.
Yeah, of course, religious organizations are able to maintain the social distancing by putting chairs apart, etc. But when you're campaigning in public, we generally see crowds of people coming to listen to a political party leader or an official that's vying for power in the area in this instance. And there's no social distancing because everybody's gathering together to try to listen to what's being said. And I guess that's the concern.
Shahan, we have to actually worry more about any indoor gathering, political or religious or otherwise. Our buildings are not adequately suited for the kind of ventilation that is necessary to prevent the spread of the Delta variant. I would put up with some sort of outside gatherings if they, as you say, they're done correctly with distancing, and people are wearing masks, and there is also kind of good hygiene practices. But the problem is, in reality, people don't follow these things. That's where the real issue is. If people were following these precautions accordingly, we could put up with it. As we see, when people go to vaccination sites, they actually try and follow precautions. But we cannot guarantee that the precautions will be followed when there are gatherings. But Delta really is a problem in terms of airborne spread when it's indoor. That's where my concern is the biggest.
Yeah. And then, Prof, of course, the other concern for gatherings, 250 indoors and 500 outdoors, is the groove, right? I think that's what youngsters call it these days, groove. I'm going to groove, they say. That, of course, because people are drinking, there's no masks, so there's no protection. And that is also going to contribute to a higher infection.
Yeah, I think that's also why it's still so important to maintain the curfew, because the kind of groove community in the middle of the night can be out of control. And we saw this leading up to the third wave. And it's unfortunate that, of course, people are really yearning for what we call normal life so that they can enjoy themselves. But really, we can get there faster if we get vaccinated. For a lot of people that are saying, let's get people back into churches and religious gatherings and so forth. Let's get people back into restaurants and groove community and so forth. People can get vaccinated to get there faster. I've also had the Minister of Health saying that, in preparation for the 1st of November, people need to get vaccinated. And it's true. And I really think, Shahan, that we can turn many of these gatherings that are coming up into vaccination campaigns. If we did that, we can hit two birds with one stone and really prevent many of the risks that would be there. Because I imagine that if a political rally is also a vaccination campaign, people are likely to follow precautions just because we would be approaching vaccination in a way that is non-partisan, not necessarily attributed to any political party.
Yeah, well, if you look at the stats, it looks like people are more likely to go to groove than actually go to vote in this upcoming election. So they might as well put the vaccination sites outside the bars. But, Prof, let me ask you about this vaccination passport. This is a hot topic in South Africa. It's still trending because people are for or against it. What are your thoughts?
Yeah, Shahan, the problem is labeling it a vaccination passport in itself. One, it implies that it's supposed to be a pass to get through into something. It allows you permit to enter spaces or travel and so forth. And that is one problem. It means that people are restricted in one way or another in terms of access. And that there's a little bit of an injustice there from an individual rights perspective. But also, I think the problem is that for a lot of South Africans, it invokes a lot of trauma from the past where people are constantly thinking of a pass. And so, it's almost like some sort of authoritarian rule. And, we have a history of apartheid in this country, which is why I think that people just need to understand this differently in terms of vaccination certificates, proof that you've been vaccinated, and also the fact that that proof can help people in many different ways, in terms of medical follow-up, in terms of proof of side effects. And there's so many benefits of vaccination certificates that I think the communication campaign around this need to highlight, and not necessarily highlight only the issue of vaccination passport, because that really relates to mandatory vaccination, and that issue has not been adequately addressed in South Africa, unfortunately.
Yeah, even the World Health Organization says it's not a good idea because of the fact that there's no equity when it comes to vaccination. So when should South Africa, and I'm not saying we should even call it a vaccine passport either, but when should South Africa look at something like this so that we can slowly return to normality? so that we know people are vaccinated or not? When is that even considered outside of traveling abroad? Where else do you need it? Where else can a business say, I want to see if you've been vaccinated or not?
You know, I think that, Shahan, in my view, from a public health ethics framework, it is allowable for a country to mandate vaccines. Where I draw a line personally is when a vaccine passport or a vaccine certificate is used for someone to lose their job. That becomes a problem. I think, even the law says there needs to be reasonable accommodation for a person. And in this whole discussion around what Discovery and other companies are doing, we've been looking at reasonable accommodation to say what does that mean? And we live in a country with high unemployment rate, and we have to really look at our context. In the same way as you say that we need to look at where we are in terms of opportunities for people to get vaccinated, there's still a lot of concerns that people have raised around vaccination that we yet to address adequately. I think once we have done that, it's okay. And we know, even with the notion of herd immunity, that not everyone who does not want to take a vaccine needs to be vaccinated, because from an infectious point of view, they can be protected by people who are vaccinated. So, a time will come when we will drop restrictions when most South Africans are vaccinated, like in Ireland. And, when we drop all these restrictions, then it's not going to matter whether people are vaccinated or not. The passport is not going to matter. So there's a period between where we are now and a period where we reach about 80% vaccination that makes it very difficult and really results in all these vaccine mandates. But once you've gone beyond that high level of coverage, then we see many countries dropping pretty much all of the restrictions. So I think as a motivation to reach high vaccination levels, it may be considered in that sense, but not necessarily as something that is permanent.
All right. Friend of the show, thank you so much, Professor Mosa Moshabela, Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal.